Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello, and welcome to another episode of the Unreal Results podcast. So, just a reminder that the podcast for the summertime, so about a month and a half between beginning of July and the middle of August 2024, we're going to be doing some reruns, but not whole episodes, just clips of some of my favorite things that I've covered in the last 66 episodes. So I'm going to be focusing on more of the episodes that haven't got as many downloads as others. Just thinking that, not sure why you missed it, whether it was timing of the year or the title or whatever. Want to make sure you get the information. And then also, I know that when it comes to learning stuff, whenever you can hear it, repeat it again, it's going to have a better opportunity to sort of be absorbed and stick. And then also, my experience and a lot of the mentorship alumni experience is when you re-listen, re-watch material, go back to it in another year, in another time, sometimes you hear and catch different things, because often what we pick up in a class or what we pick up in a lecture is what we need to hear in that moment. And you are a completely different person now than you used to be. A completely different practitioner, especially if you've been listening for a while and implementing some of these practical tips of utilizing a more true whole body approach that considers the viscera and the nervous system in your assessment and treatment plan. So maybe it is exactly what you've already heard, but you're going to hear it in a different way and pick up different gems and different information from it. So I hope you enjoy it. I'm curating this specifically for you. And yeah, thanks for being here. Enjoy this episode. Hello. Welcome to another episode of the Unreal Results podcast. We're still doing the rerun clips for summer. This clip is from an episode called Assessment is Sexy. It's actually a guest episode with my friend and colleague and team member Lex Lancaster. We discuss how important assessment is in getting good treatment outcomes, even though it's not the same thing that sells. In fact, the majority of people, when they're taking continuing education classes, are so focused on treatments, treatment tools, and even in a session, right? People are so quick to dive into the treatment that they skip the assessment piece. By skipping the assessment piece, we miss the opportunity to really figure out where to start treatment, why to start treatment there. And that's really also when we don't get the results that we want. When we take the time to do an assessment, especially one like the LTAP, that takes into consideration where the body is directing us, the results are so much better, and the treatment needed doesn't have to be as long. So I hope you enjoy this clip from this episode. It's a great episode. You get to hear about an assessment and treatment I did on Lex that took her 9 out of 10 shoulder pain down to 0 out of 10 in just 30 minutes. So enjoy. You got home and you're like, I hate to ask you, but I was like, when my shoulder, like, are we going to get to my shoulder? I was like, yes, actually, yes. Let's. So I put the table up and I was like, if we only do 20 to 30 minutes, like, at least it's a start.
Yeah.
And so I did the LTAP on her. And so again, the LTAP is an acronym for the Locator Test Assessment Protocol. And it basically is a series of tests that gets me to where the body wants me to start treatment, in terms of it directs me to where the body is protecting, because when the body is protecting something important like visceral organs or the central nervous system, then the whole musculoskeletal system sort of like goes into a like a hug, or like a pattern of protection. I just told people on the results sheet code this week, I was like, it's almost like the pattern you see when somebody has appendicitis, right? They're bent
Mhm.
over and their side bent to the right. Like that is your body going into a severe protection pattern for something. So same thing, like when we have a protection pattern on any visceral organ from a, disease standpoint, a limited function standpoint, or just the organ is not able to move within the container because of its ligaments being stiff or the space being limited for whatever reasons. Um, the body goes and it sort of arranges itself around that structure.
Yeah.
On top of that, you'll get visceral referred pain from the nerves and the relationship to the nerves to that organ and then the rest of the body. And so the LTAP helps us to figure out where, because when we can do treatment in that location, we get people out of their protective response and we see a completely different picture of their posture and their movement patterns when they're not in that protective pattern. And so many times their protective pattern is what's making something hurt.
Yeah.
so, um, so her assessment um directed us to her liver and her central nervous system. So what I did on her is, especially I guess if for those of you who've gone through the results cheat code just coming off of the three free week of it. So what her assessment would have looked like is her SI joint was hypomobile on one side. I don't even remember what side it was hypomobile on, but it kind of doesn't matter. But
Mhm.
one side of her SI joint was hypomobile, but when she held her breath, it became mobile. And so that directed me to the central nervous system or the viscera. Now, the rest of the LTAP was able to tell me it was actually first round was not central nervous system, it was liver. So I treated her liver first. And then before I treated her liver, we looked at her shoulder mobility and her
Yeah.
shoulder function. And like I said, in a supine position on the table, she had a hard time finding a comfortable position. So just that passive, like I guess that would be passive shoulder extension, was painful to her.
Mhm.
But then when I tested her abduction, she had resistance very soon in her abduction range, which is like technically a upper limb nerve tension test.
Mhm.
Um, I think I also did like a traditional like a median nerve glide, and that had a lot of tension on it. Like pretty immediately when I started to extend your elbow. Um, and she was lacking upward rotation and protract, like general upward rotation of the scapula was
Mhm.
lacking, and definitely, like she said, limited internal rotation and very limited horizontal adduction, and those two were painful.
Mhm.
And I don't think the passive abduction was painful though, but it was very resisted, and it's almost like your whole glenohumeral joint was not inferior gliding very well
Yeah.
too.
I
Yeah,
remember you saying that.
yeah. So again, because we were in a limited time crunch, I was like, this is enough objective information. Like, yeah, clearly your shoulder is limited in mobility and unhappy, and your scapular mobility stability is not great. So
Mhm.
let's see how it changes. So I did a really simple liver treatment on you. I believe I think I did a liver lift, and then, like, maybe that one where I'm, like, hugging you from the
Yeah.
side. Yeah.
Yeah.
So, like, a three-dimensional, like, induction of the diaphragm and the liver together. Um, and, then I was like, "Okay, we treated that, and we laid you back down and retested stuff." Her SI joint was still hypomobile, and it still changed with the breath hold, so it's telling me there's still another layer of protection pattern either in her viscera or her central nervous system. This time it was her central nervous system, which is the second test of the LTAP. So I tested that, and that was confirmation. And, then I retested you before I treated that, I retested your shoulder objective things, and you were much more comfortable laying on your back. In
Mhm.
fact, we noticed too, like your rib hump from your scoliosis,
Oh,
like, was totally
yes.
different. Totally,
Yes.
almost almost I don't wanna say I hate the word neutral, but, like, almost looked like the other side. Like, you could barely tell that you even had a rib hump there.
Yes, I forgot about that.
Yes, and then your shoulder abduction, it was like, "Oh, no problem." There was still, like, a little lacking in, inferior glide, but, like, it was, like, so much easier to go into hip shoulder abduction, and then it gave us a little, adduction and improved your internal rotation, and I I think I think already with just the liver treatment, you didn't have any pain, but I was like, I think I could get you better range of motion by doing the central nervous system piece. So then I went to the central nervous system piece and I did a little work in like your C4 area, a little cranial piece, like greater nerve of Arnold, sort of occipital nerves. And I think I did one little brachial plexus neuromanipulation thing, and then we retested everything and your nerve tension was almost completely gone. The rest of your glenohumeral joint inferior glided, and then your adduction finally could come across your body as, as good as the other side.
Yeah.
And you're like, "Oh my." We were
Yeah.
both like, "Oh, there you go."
Cool.
And then I was like, "I know she's gonna go play beach volleyball in the morning and, like, fucking jack it all up." And then you messaged me 'cause I was like, well, I was pretty confident that you would feel better, but I was
Mhm.
like, I don't know, the volume of volleyball she's gonna play and how much pain you were in, I was like, hopefully she doesn't mess up what I just did. But, um, as with everybody, I'm like, I'm just always curious. I'm like, go do your thing. I never tell people not to do stuff. And so I'm like, go do it. Like, let
Mhm.
pain be your guide. And, from a home exercise program standpoint, I would have you do, breathing and liver work or like thoracolumbar junction rotational stuff and, see how you feel. And then like maybe 5 days later, you sent me a Voxer and it was like, "What I feel amazing." And I was like, "What?"
Yeah.
So all I used held that piece.
Yeah, I've had 0 pain since then, so
Yeah,
I've had nothing, like,
yeah,
I will say, like, you can see, like, my hand is in the middle of my shoulder blades right now,
yeah,
like, I have no pain,
yeah,
um, so that was great. That's been amazing to not
yeah,
have any sort of shoulder pain. I will say I was surprised about volleyball because of the amount that we play and just how many swings, the
yeah,
volume of swings in a weekend, a very short amount of time,
yeah.
and I had no pain at all. I went right back to lifting. I went right back to doing all the things. I had no issues at all. And I was skeptical up until like month 3. And I was like, when is it going to return?
With
I was waiting and waiting and it never returned, and I was like, "Well, this is cool." But I will say, like, because I am going to be honest right now,
yeah.
um, throw myself right under the bus. I am the worst person to, like, do something about my pain. So, I have tried with my shoulder, I was like, "Alright, cool. I'm gonna do some overhead kettlebell upside down presses. We're gonna work on some stability. We're gonna do some." I was told over and over again by a couple different people, like, "You just need to work on your shoulder stability. You'll be fine, yada, yada." All the scapular squeezes. I've done all the I lift with good form. And I'm like, "Okay, I'm a PT. It's still not going away. I'll just leave it." Like, and I wasn't gonna go consult someone just for my shoulder. It just didn't bother me enough to do so.
Right.
And then it was like until it did, obviously. But
Yeah.
so when that like the reason I mentioned that is because when I got home, it's not like I was doing your home exercise
No,
program.
no, you weren't.
Like, I'll be honest, I don't want people to feel like, "Well, what did she do between?" I did nothing. Like, Anna Anna sent me a video, and I did 1 round of this, like, ball on my diaphragm and rib cage area, and I was like, "I think I'm good."
I'm good.
So, I did nothing. Anna did the only treatment, and then, like I said, it was like a 30-second, "I'm gonna give this little ball a try."
Pain is a great motivator.
Yeah.
Um, even though you didn't do the home exercise programs I recommended, you did start honoring your curves a little bit better.
Yeah.
Yes.
Yeah. Yeah.
which so again, like, honoring her curves and scoliosis, I think, helped a ton with
Yeah.
it sticking because then she was meeting the when you honor where the curves are and when she propped herself properly, her body naturally gave space around the area of the liver, and
Mm.
then everything's gonna function better. So
Yeah.
that I think even though you don't think you did anything, I think the awareness and, like, the accepting that it was okay to meet your curves where you're at, because before that, you felt like you had to, like, organize your
Yeah.
body in some sort of weird way because you had scoliosis, and I was like, "No, just lean into it a little bit. Let your
Yeah.
body organize itself." And so I think that did help a lot.
Yeah.
And then, yeah, the second time I treated her was more because I was visiting her in May? April?
No, it was March.
March?
It
Huh.
was like 2 weeks after.
No, it was longer than that because
April? Oh,
it
it was
it was April. Yeah, the
yeah,
3rd week
early
of April.
April? Yeah.
Yeah, so, like, maybe a month later,
Mhm.
I was on the East Coast and had a few days off, so I went up to New Hampshire to see her, and, like, more just socially, but while
Yeah.
I was there, I was like, "Hey, I wanna do the diaphragm and liver treatment on you one more time," because of what I felt in my own hands, because when I
Oh,
treated
yeah.
you in March, it was literally the stiffest diaphragm I've ever felt before.
I remember you saying that.
And I was like, "Oh," which is another reason why I was like, "No way this is gonna stick
Yeah.
without especially without you doing the exercises." And so, I was like, "Lex, I would just really like to get my hands on you also out of curiosity because I wanted to feel your diaphragm again." Because I
Mhm.
was like in my head, I'm like, did it make that much change with one treatment that you're still not having pain?" And I was like, I just feel like it would be better for the both of us, my brain and your body, if I could get my hands on you again. So I did another treat, and I didn't even do a full treatment on you. It was literally like I did the assessment to make sure that was like that I was close to what your body wanted, and
Yeah.
it was where you're listening, like, where your LTAP was taking me again, and so I was like, "Okay, perfect, we'll do it," and I did it, and her diaphragm, though still stiff relative to other diaphragms, I feel, was so much better than it was a month before, and it was I mean, it was so much better that it didn't feel it didn't feel out of the ordinary. It felt like a lot of other people's diaphragms that I feel. And so that was really cool too for me to see like how well you did keep it, which again, I think is because you were honoring where your curves were and letting your body organize itself. And then I did just give it enough information. And I feel like too that one of the other reasons why things got such good results for you is because we didn't do a lot for treatment.
Yeah.
We went right to where the body needed me to do something, and we did something there, and so then the brain could focus on what it needed to do to keep that area happy, and I didn't confuse it with a bunch of manual therapy in other places, which is probably I know it's the hardest thing for me to
Mhm.
do with my patients is, like, know when enough's enough.
Yeah.
In the Barral Institute, Jean-Pierre is always like, it's, leave a little some like, leave some on the table, like, let the body do its job, like, don't overtreat is like a message of their courses, and I mean, I feel like every single practitioner that goes through their work, like, overtreats. I
Yeah.
feel like every practitioner in general overtreats, and so I actually think the fact that we only took 30 minutes to treat you the first time is part of the reason why you had such great outcomes as well.
Yeah. I feel
Um,
like
which
on
is
that note, there's 2 things that I wanna say
yeah,
that I feel like people might not be hearing yet. The way that your treatment feels, right? So, like I said, I don't seek treatment, but I have treated people.
right,
So, the way that your treatment felt was very minimal. Like, I
yeah,
was like, "Did we do anything?" Like,
yeah,
honestly, like, it didn't hurt. I wasn't, like, biting a pillow and taking a rock blade, not that you would ever do it with a rock blade, more or less like any sort of, instrument where you're pushing me to, like, cry, like, there was none
yeah,
of that. There was no sort of, I'm gonna pin and stretch you, do all this stuff, like, all the touch was very gentle,
yeah,
and you didn't really touch my shoulder.
No,
Like,
I
you didn't treat my shoulder.
just assess it really.
Yeah, yeah, like, you assessed it, but the treatment was not there, and for me, you know, yes, we all feel that, you're going to have to do something to that area for the person, obviously, like, put up the fire out, touch the area, whatever, but, like, we had limited time, and in that limited amount of time, you didn't treat my shoulder, you treated everything else, and I feel like had I gone somewhere else, I would have had my shoulder treated.
Yeah, for
And
sure.
I don't know what that would have looked like, whether it was dry needling, cupping, whatever it may be, but I think that would have been a miss because now I have multiple visits when you treated me in 30 minutes.
Yeah. Yeah,
You know
for
what
sure.
I mean? So it's like I don't know if I understand the treatment is going to be different for each person, but like when for me internally I was like, "Wow, I just saved myself a ton of time and
Mhm.
I feel fine. I feel perfect with that treatment and there's no need to now go 3 times a week for however long or even once a week for 6 months."
Right.
Like, you know?
Yeah.
Um, I
And we
also
were prepared. I mean, I had gotten the cups out and the needles, like,
yeah,
I was
you
prepared.
did.
Yeah,
Yeah,
I
you
was like,
did.
"Oh, fuck, this is gonna, like"
Yeah,
her shoulder really hurts. We were both surprised
yeah,
at the outcome. And that's, like that is, like, every day I treat someone, I am constantly surprised
yeah.
because my assumptions based on my first 10 years of practice
Mhm.
are always blown out of the water with what actually happens in front of me when I'm paying attention to the body.
Yeah,
And also, it's just goes to show is like, like you said, you've done a million exercises and even with the scoliosis, like the
yeah,
whole like I let your body organize itself.
yep,
Movement is an outcome. And so like how can I change the inputs so that I get the preferred outcome?
right.
And that was a really good example of what we did. So
Yeah.
yeah, so I treated you that second time and then yeah, you've literally done nothing and you play volleyball all the time and you lift and
I'll say I literally play volleyball probably 8 plus hours a week. Like,
yeah.
I have no issues, and I will say, like, I'm sitting here touching my ribs because that was, like, an aesthetic thing for me.
For
I hated that. So, like, whenever I'd lay down on my back, you could very much so see a discrepancy in my ribs, and it was always something that I was self-conscious about, and I didn't love it, and I always thought, like, "This is the way it is, this is the way it's going to be," and when that was the same, I almost lost my mind.
Yeah, you got a little, like
I got emotional. I was
yeah,
like, "What?" Like,
yeah,
this is different, and I'm touching it now, and, like, it's definitely way less pronounced.
yeah, oh, I'm sure.
It's
Yeah,
way less pronounced, and, like, when you talk about my diaphragm being the tightest that you ever had felt, like, it all makes sense.
yeah,
But for that to be a big change too, like, mentally for me, that was awesome.
yeah.
That was
Well, and
awesome.
it goes and again, like, I think too, like, diaphragm was the tightest I ever felt, but yet it just took one treatment for it to change, and the reason being is that the tightness was a neurological thing.
Yeah,
Yes. It
yes.
wasn't I mean, I'm sure there's a little bit of layered upon, like, stiffness in certain
Mhm.
areas from your scoliosis, but the majority of what was happening was the diaphragm was splinting the liver. The diaphragm was like, "I don't want you to like, we cannot move. Like, we're not going to allow any more movement here because something might hurt the visceral organ."
Yeah.
And so as soon as we like did the treatment around the organ itself and got it to gently move and like she said, yeah, it's everything's really gentle and even I did a visceral manipulation technique on her, which is gentle in general. But even when I do cupping or even when I do exercise, anything I do, I'm always doing it over in that protection position. And so
Mhm.
it never is going to feel like threatening and forceful. And of course, too, then I back off depth if it does, or I back off intensity if it does, because I know that the safety is like such an important thing that the patient needs to feel in order to tap into the body's ability to heal, that
Mhm.
why would I do anything to contradict that?
Yeah, I liked watching you cup in that way.
Yeah,
Because I saw you do that. That was the first
yeah,
time I had seen someone go with the way that like, the
yeah.
least
Go
restriction.
into
You
the ease. Yeah, the direction
yeah.
of ease. Yeah,
Yeah, direction of ease, and people don't really do that. They go in the opposite direction because that's
yeah,
what needs to be mobile.
yes,
But so when I had watched you cup, I think you were cupping Shantae, and I was
yeah,
like, "This is really
yeah,
cool."
yeah.
Um,
Oh, yeah, I forget that you did see me treat her one day.
yeah.
Um Yeah, the other thing too is like, it doesn't mean that I never do, because that's called an indirect treatment. It's not like I never do direct treatments and like go into the tension, but I only go into the tension when the body takes me there and
Mhm.
like clearly wants to do that. And in my experience, it's usually only after I've gone indirectly into the ease that
Yeah.
then it sort of reorganizes itself and then opens up into the tension and we can get more out of it. So, and that's a little bit too of like, I always give everybody goes through my education. And even in the podcast, I did like an intro to movement rev methods and philosophies. And because that is a very osteopathic philosophy that I learned through the visceral and neural manipulation from the Burrell Institute. And it's not like, it's not like they out and say it, but it's like as you're learning the osteopathic techniques through them, those principles are conveyed. And I
Mhm.
recognize that it was in direct opposition of traditional sports medicine, and I really felt like if I was gonna take this stuff on, then I couldn't just be doing half my other treatments this way. It didn't make
Yeah.
sense,
Mhm.
right? There was a lot of dissonance between the 2, and I was like, if I'm really gonna assimilate the information together, they need to resonate with each other, which means I need to decide what philosophies make sense to me and see and here is this is almost like a way to prove like things are true. If the philosophies are truly true, they should be able to work with any technique.
Yeah.
Right? And so then I took the techniques from the traditional stuff that I love to use, like the cupping,
Mhm.
and I was like, well, let's just do it on this philosophy and see what results I get because I already get good results from just the tool. And then that was when I was like, wow, I get even better results. And
Yeah.
so that's when I realized too that it's like, no, the principles are more important, which, and always goes back to the Emerson, not Ralph Waldo Emerson, but Harrington Emerson quote about principles and techniques. The
Right.
fact that we learn techniques in order to understand principles. But once you understand the principles, you can make up your own techniques.
Mhm.
That is exactly what I've done is taken these principles of osteopathic medicine and applied them in a new way with old tools.
Right.
And that's what you felt is it was very gentle and it was gentle yet so profound and impactful.
I feel like I'm gonna pretend like you planted this question. She didn't plant this question for anyone watching or listening, but I want to ask it because I feel like people who are like me, I have not taken any Brawl classes. I know
Right.
nothing about osteopathic listening, other than what I've watched Anna teach. But for me as a PT, if I were you and I was treating someone like myself for the treatment, obviously you used osteopathic principles to treat me. Like you
Mhm.
did the diaphragm release, you did a
Oh,
liver
tools.
treatment.
I
Tools, yeah. So what would you do differently
use tools.
if you didn't have those tools?
Yeah, I would have used the dynamic cupping
Mhm,
around the anatomical borders of the liver or like around the whole area of the liver. I probably would have gone and done some sort of spinal mobility, either manual therapy or just movement at the segments that innervate the liver, and then which are think T7 through T9, maybe T10. And then I would have gone to C4, C3, 4, and 5 and done some manual therapy there. Even your body took me there anyways, but I would have probably done it in either way because that's where the phrenic nerve comes out and that's the sensory to the liver. I would have done some side bending and like the exercise I gave you for
yeah,
home care, like cortisol, the sideline breathing, I probably also the other exercise I gave you was the Da Vinci rolling pattern, so I
yes,
love the rolling patterns for that area of the body.
yeah,
The reason why I love Da Vinci rolling specifically is because it does opposition and it twists it emphasizes rotation at the area and the diaphragm, that's, like, the best way to stretch it isn't rotation. So the Da Vinci rolling with actually a pause while you're twisted and breathing into that area,
mhm,
like, that's how I would have mobilized the diaphragm the most and then probably done some sort of like segmental spine thing to work on the articulation of the liver and the diaphragm like a ball and socket joint.
cool. I ask because I want people to know you don't have to
Yeah.
understand osteopathic, tools in order to
Right.
treat
Yeah, you don't
and
have
use these
to.
principles.
Right, you don't have to have visceral manipulation or neural manipulation tools, you just, and that's what I teach in my courses and,
Mhm.
in terms is, like, you already have tools that can affect the viscera, it's just you don't realize that they are affecting the viscera, so
Yeah.
I'm just giving you a new lens of view so you can see that a spinal roll down is this articulation of the diaphragm over the liver, and you can even cue it that way. And when you cue it from the deep from you when you use the organs as imagery cues to cues movements, the movement quality is very connected and very deeper. It's a totally different experience. And so, um, but yeah, I like tools that I've been using my whole career that I just use now for different reasons. Yeah.
Yeah, and, like, we've talked about it between us 2 of, like, treatment is chalked up to be super sexy. Like, I'll
Yes.
do all these sexy things for
Yeah.
treatment. But, like, if you don't actually start where the body is telling you to
Yeah.
start,
It doesn't matter.
like, great. Now you're either wasting the person not wasting the person's time, but you're making them come for longer, you might be
Yeah.
missing something.
Yeah.
So, it's just
Yeah.
I think the assessment part, like, learning from Anna and watching Anna teach and being a part of her community has definitely drove home the principle that assessment is the sexy part. And when
Yes.
you nail the assessment, then the patient is happy, you get good results. There's really there's no negative when you're
Yeah.
nailing the assessment.
Yes. 100%. 100%. The assessment is the sexy part.